meie järgmine ettekandja on siis Rootsist Sven Román, kes on lastepsühhiaater ja temaga teeb meile ettekande Rootsi andmete põhjal, kuidas oli siis pandeemia ajal Rootsi andmeid kokku korjata, kuidas neid analüüsida ja mis ta siis sealt leidnud on. So, mycket välkommen Sven och tack för hela språket. Ja me panime korra, ole ja korra pange tagasi veel, et meil on nüüd see lugu, et meil on üks ettekandja, kes peab kohe pärast viimast ettekannet enne lõunapausi ära lendama. Et kui teil on nüüd küsimusi tekkinud, siis pildistage ja tehke mal see QR lahti telefonis ja saate sinna küsimusi kirjutada. Et siis me saame veel siin hästi kiiresti mingid kiiremad küsimused, eriti mis on doktor Aleksandra Kaudele seal lõpus, et saame tema käest ära küsida, sest tema ei saa diskussiooni kahjuks jääda. Aga nüüd on sõna Svenil. Sven, please, here you go. Thank you.
Okay. Thanks a lot for being here. You have read this headline for the lecture, and firstly, I'm very honored to be here, and I'm especially nice to be in Estonia, because of all foreign countries, your country is in second place after Finland for the number of visitors to our website since the conference in Stockholm, and here you can see that in the red bar, that's Estonia. So it's quite a pleasure to be here. And this is my disposition. I will talk first briefly about me, and then talk about the inaccurate accounting by the Swedish Public Health Agency. I will talk about the Medical Products Agency's website that gives the impression that side effects are modest. And finally, I will talk about Statistics Sweden on declining fertility. They downplay the seriousness and stops reporting despite worsening trends. I'm a child and adolescent psychiatrist and a specialist from 2010. I have a broad experience in both inpatient and outpatient care. With a psychologist, I have participated in over 500 neuropsychiatric investigations. For the last decade, I have participated in the public debate on general psychiatry and child and adolescent psychiatry in particular. For example, I have been involved in the gender reassignment treatment of children and young people with gender dysphoria, which I am very critical of. I'm one of the founders of the Doctor's Appeal, Läkaruppropet, launched in March 2021. And I am one of the main organizers. One of the other main organizers is Jonathan Gilthorpe that spoke before. The conference Pandemic Strategies, Lessons and Consequences in Stockholm in January this year. We had over 1,050 participants. And the films from the conference have had about 2.3 million unique views. And according to Oracle Films, no conference on a different approach to the COVID-19 pandemic than the official one has had so many views. So we are very grateful for that. Okay, then the first part of 3. The inaccurate accounting by the Swedish Public Health Agency. From November 2021 to February 2022, the journalist Per Shapiro asked critical questions at the weekly press conferences on COVID-19 by the Swedish authorities. It was a collaboration with us, with the Doctor's Appeal, on key issues. And Shapiro's questioning went viral, but the authority, they repeated the mantra that the vaccines were safe and effective without ever actually answering the journalists' questions. And we posted the short films that were viewed, and sometimes they were viewed over 100,000 times. The authorities and the established media tried to censor and reduce the dissemination of Per Shapiro's questions. And after a few press conferences, he was regularly asked to present his questions at the end of the media Q&A session. This coincided roughly with public service TV, which was broadcasting the conference as live, interrupting its live broadcast just before Per Shapiro was about to ask his questions. At the last two press conferences with Shapiro, the ignorance of the authorities was completely exposed, and it was subsequently announced that there would be no more press conferences. At the press conference on 27th of January 2022, Per Shapiro asked Britta Björkholm from the agency about deceased vaccinated persons being recorded as unvaccinated if at least 14 days had not passed since dose 2 was administered. So he said, "So why are you clouding the real control group? And when are you going to report on how the non-vaccinated have actually fared compared to the others?" And Britta Björkholm, she answered, "I don't know what to say. We have a lot of data, we have a lot of figures, we follow up in many different ways. I think we are transparent and report what is relevant." We decided to dwell in this theme from the last press conference on inaccurate accounting by government agencies, including the Swedish Health Agency's accounting of the vaccination status of deceased persons with COVID-19. And they do it as the group of vaccinated that has got 2 doses, at least 14 days have passed, unvaccinated, completely unvaccinated, but also those that got 1 dose or 2 doses if less than 14 days have elapsed. What are the consequences of this if you count like this? Well, here I will give you a hypothetical example. Mortality of an infection is evaluated over 6 months for vaccinated and unvaccinated, and it's 10,000 people in each group. And the outcome is 100 persons die of the infection before 14 days have passed after dose 2. 5 persons die in the vaccination group after at least 14 days have passed after dose 2. And 25 persons die in the completely unvaccinated group. And now we will look the outcome if you count as the agency and if you count as we think you should count. First, the agency. 5 deaths out of 9,900, because the 100 deaths before 14 days after dose 2, they are excluded. And then the mortality rate would be 0.05%, that's quite low. And the unvaccinated group, it's 125 deaths out of 10,100, because you have to add those 100 that died before the second, it had gone less than 14 days after dose 2. Then the mortality rate will be very high, 1.24%. But if you count as we think you should do, then in the vaccinated group it's 105 deaths. That's a high mortality rate, 1.05%. And in the unvaccinated group, it's 25 deaths of 10,000. So it's more than 4 times lower mortality rate, 0.25. How many deaths have been reported incorrectly from the Swedish Health Agency? From the answers at the press conferences, it seemed to be in single digits. Then, as in my example just before, mortality in the two groups would not be affected very much at all. We ordered the data from national registers on 30th of March 2022. We had to pay approximately 83 euro, and we received an answer 2 weeks later. And here you have the results. These are not isolated cases. The agency reports in 2 columns for people who have taken dose 2 but have not yet passed 14 days. The first column, you see, it's here. That's the person that have had dose 1 and less than 21 days have passed. It contains a total of 667 people. And the next group, where at least 21 days have passed since dose 1, but not yet 14 days since dose 2, contains 253 people. This has a very significant impact on the proportions of vaccinated and unvaccinated deaths. And you can see here a figure. The red bars show the authorities' official statistics, and the blue ones show the actual outcome. The number of unvaccinated deaths thus decreases. Oh, it was wrong. How do I go back? Is it? No, now I got it, yes. The number of unvaccinated deaths thus decreases by 32%. So they go from this down to that, that's 32%. And the number of vaccinated deaths increases by a whopping 135%. So we wanted now to calculate the mortality in the different age groups. So we ordered more data from the agency, and at a cost of approximately 1,100 euro. We wanted to calculate the mortality rate in different groups and different age groups. But it would take 4 to 5 months due to being so extensive. The last order took 13 days, and 2 months later the processing time had increased 10 times. Quite some inflation. And after 4 months we asked, is the data on its way? And they say at best it will arrive before the end of the year. Why? We will handle orders in turn. The agency currently has several large orders from researchers and other government agencies that are both in process and in queue. As a result, the processing time is longer than usual, blah, 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 blah. Okay. We didn't give up. And I have to look here because I have changed. In February, after 8.5 months, we have received all the data, but we couldn't calculate the mortality. We had not enough data. But we are not giving up, and we may still be able to analyze the mortality. So keep an eye on social media, where we will let you know if we publish an article on the subject. So we hope that we will do this in the future. Now I will come to the second part, and it's about the Medical Products Agency and their website. Sweden is known as one of the first countries to have a national population register in 1631, and we are known for our transparent authorities that serve our citizens. And on the website of the Medical Products Agency, since the beginning of 2021, reported suspected side effects of COVID-19 vaccine have been published. Citizens are given the impression that transparency exists. But is this the reality? Some of the pages on the Medicines Agency's website about COVID vaccine side effects are in English. That's quite good. And the agency lists the 5 most common adverse events for the 3 most widely used COVID vaccines by far, which is deceptive. Vaccine side effects thus appear very modest. For example, for Pfizer's vaccine are the most 5 commonly reported side effects. It's headache, tiredness, fever, feeling of sickness and menstrual disorder. And if you look at the other vaccines, chills and muscle aches, they are added. Nothing on the website about suspected serious side effects. This information is hidden in a PDF file provided for each of the vaccines. And here you can see the PDF files, and this is indicated with English text. But when you open the files, there is only text in Swedish. We decided to compare the number of SSSEs reported by the agency in the first year of the vaccination program, to compare this with the number of hospitalizations, including deaths, due to SARS-CoV-2 in the first year of the pandemic, so a year compared with another year. And we think it's comparable variables according to the definition from the Medical Products Agency of a serious adverse events. And it says, a report is considered serious if the suspected side effect leads to death, is life-threatening, involves hospitalization or extended hospitalization, leads to disability, causes congenital malformation or other medically important event. And we presented our analysis in an article at the Brownstone Institute signed by 5 members of the Doctors' Appeal and this special network, BMLN. And this is the article. And we calculated the number of SSSEs, that's for the vaccines, per person hospitalized or deceased with COVID-19. So we compared those 2 numbers. Studies of the reporting rate of SSEs in Sweden show that it can be as low as 1 to 2%. And since the exact reporting rate for COVID-19 vaccine SSSEs was unknown, we tested outcomes using an assumed 5%, 10% or 25% SSE reporting rate. Thus we could estimate numbers that experienced at least 1 SSSE per person hospitalized with COVID-19, according to age and sex. And now we will see this chart, and it's a bit tricky, but there are many bars. The blue ones refer to men. The ones in red shades to women. The darker the shade, the lower the reporting rate. And women and men aged 10 to 79, it's from here up, it's this part, have been particularly affected by SSSEs. And assuming a 5% SSSE reporting rate, men aged 10 to 19 years were the most disadvantaged. You can see here, that's the highest. This one, 10 to 9 years old. this group, and experienced a 14.1 times higher incidence of SSSEs than hospitalization with COVID-19. Hence, risks of vaccination exceed the potential benefits. What? Ah, I must. Okay, you can't see. You can't see. Okay, well that's 14.1, and this is the big group where you see disadvantage of the. Okay, thank you. Risk of vaccination exceed the potential benefits in the majority of groups and vaccination. And it only appeared to be beneficial in men aged over 19 years. This is the only group, because this is the cut-off. If it goes over 1, it's disadvantages for the vaccines. So this is the only age group, men over 90, where it's good to vaccinate. And this be compared with the information provided on the website of the Medical Products Agency, that the majority of side effects were mild headache, fever, fatigue, feeling sick, menstrual-related chills, and muscle aches. And here I will show you the number of deaths per 100 inhabitants in Sweden since 2003 for the last 20 years, because it's interesting to see how it has gone now in 2022. And then we also have a regression analysis, a trend. It's this black one. And then you can see we have excess deaths 2020, that's when we had the pandemic, and that's a very large rise. But it's due to, we have the lowest rate ever in Sweden before, so we had a lot of people that were vulnerable, and we didn't treat the elderly well. They got no treatment at all, and many got palliative treatment. So I think that thousands of people died wrongly because we didn't do the right thing. And then 2022, we have the second highest excess deaths for all those 20 years. The second highest is 2.5% higher than the trend line should say. So we have had a lot of people that have died of the vaccines, I think. Then to the last part, it's about the statistics Sweden. And they announced in August 2022 that during the first half of 2022, the birth rate was the lowest since 2006. It had a decrease of 6.7% compared to the previous years. This is remarkable and should have resulted in a huge public interest and media coverage. But only very few media outlets reported on this. And I think because I don't have so much time, I will jump further. The childbirth remained low over the subsequent 8 months. Yes. So it has been lower in 14 months now. And we had made the calculation that we think that SCB should have done. We have performed a regression analysis for each month of the previous 10 years before 2022. That's from 2012 to 2021. On the number of children born per 100,000 women aged 18 to 45 years. And then we have obtained expected results for each individual month from January 2022 to February 2023, so it's for 14 months. And we have compared them with the actual outcome. And then it looks like this. First you have the 3 months before 2022, and that's very low very small numbers, but then you have declining like this, and the most declining, it's for the three of the largest is the last 5 months, largest decline, and approximately for those 14 months, approximately the fertility rate has decreased 9%. And to put this in a proper context, you have to have a historical perspective. So we do a slightly coarser analysis. We're looking at the nativity. That's the number of children born per 1,000 people in the population. And then you will get this figure. This is from 1900 and to 2022, and it's also a rolling 10-year trend, this red one, and the blue one, that's for each years, and the yellow, these things, it's where it's have raised a lot or was a great decline. And we have this decline. It's the biggest one. It has only been a bigger decline 1 year, and that was this year, 1921 or 22. Here we had the Spanish flu, and then after the Spanish flu and the World War I, there was a quite very large raise in the birth rate, and then you had a decline, and all the big declines, it's after it has been very high rates of births, but we don't before this it was not a high rate before, so this has never happened before. And you can also read an article in Daily Skeptics. I and Jonathan Gilthorpe, we have written about what I just said about birth rates. So if you want to go deeper into it, I could recommend this at Daily Skeptics. And then I will lastly talk as Abraham Lincoln. How long will disinformation be able to continue? You can fool all of the people some of the time. You can fool some of the people all of the time, but you can't fool all the people all the time. Thank you.